Let's talk about the government shutdown. It is now in day 14. And of course, the sticking point for Democrats that are dug in about healthcare costs and the health insurance subsidies. So, here to break it down for us is certified financial planner Bobbi Rebell. She's also, hi, Bobbi. Sorry, we had some technical
I
difficulties there. Great to have you here. You are also the consumer finance expert at cardrates.com. Okay, can you give us just a very quick thumbnail, a quick understanding of why these healthcare subsidies are important?
They're important because people's health insurance premiums, if you're in the ACA, the Affordable Care Act, also known as Obamacare, we call it the healthcare marketplace. If you're in that, your health insurance premiums could go up as much as 114%, according to some estimates. So a lot of Americans are going to be hit with very expensive premiums for their healthcare, and that has people worried. The sign up time, open enrollment starts November 1st. So that's what the Democrats are focusing on. What the Republicans are saying is that the enhanced subsidies, those are extra subsidies that happened during the pandemic and have since been extended, they don't run out until the end of 2025. So that's why there's sort of this debate about when we should be talking about it. Ironically, though, a lot of Republican constituents, a lot of those red states have people that might be hit a little bit harder. So it's an interesting, delicate dance that's going on right now.
Yes, I mean it's interesting. People like Congresswoman Marjorie Taylor Greene, for instance, are talking about it in a way that is not in keeping with the Republican talking points because she knows her constituents are going to be demanding answers. So I know you said they could go up 114%. What are the dollar signs there? I mean, what are we talking about? From 200 to 400 bucks? Like what how much are people generally paying?
That sounds great to a lot of people. These numbers are really big, Allison. So, for example, according to KFF, that's the Kaiser Family Foundation, average out of pocket annual premium payments for subsidized enrollees are expected to jump 800 from 888. I'm reading off paper to make sure I get this correctly. 888 to $1,904. That is a lot of money for people to swallow. So, one thing I want people to start thinking about is how they're going to start paying for all of this because those numbers are big.
They're huge. Okay, let's talk about that. So, what tips do you have for people who are going to see an increase like that?
First of all, eyes wide open. Go in and start looking and be ready. Be realistic about your healthcare needs. Read and understand all of your plan information. Understand what it covers, what it doesn't, and then start gathering information to make the right choices. That might mean generic drugs instead of brand drugs. It might also mean doing some research ahead of time about what medical procedures you might have to have in the next year or going forward and what they cost and using online tools. One of my favorite, carecredit.com/FFP. That stands for Fair Financing Principles. That'll give you, you put in your zip code and the medical procedure. It'll give you what it should cost so that number one, you're kind of mentally prepared. You can start financially preparing. And also, maybe you can have a conversation with your doctor, with the medical team that you work with, and figure out if they're maybe charging more than in your region. And maybe there's some negotiability there.
Yes, absolutely. I think that's a great idea to start talking to your doctor and just relying on their expertise as well as compassion about how you're going to plan your next year. But in terms of those dollars, Bobby,
Yeah.
that's a lot. How are people supposed to find that extra $800 out of thin air? How are they going to pay for their monthly medical premiums?
It's gonna, first of all, let's just say it, it's gonna be really hard, and that's why we're having so much friction in Washington. Now, if you are in an employer-sponsored plan, if you have a job with a flexible spending account, that is your first line of defense because that is pre-tax dollars, so that money is gonna go further. The same thing with the health savings account. If you do that, you might have a high deductible, healthcare plan. Those are often a great deal. Companies often put extra money into your account. You can use it and it never goes away. So that can, of course, if you don't use it, be used for things like retirement. That's a whole other segment, Allison. But then you want to look at financing, which is really hard. But what I want people to avoid is going directly to the credit card that you already have in your wallet because if you don't pay that bill on time in full, you're paying interest right away. So, what you want to do is buy yourself some time. You can do that with things like deferred interest, and you want to understand what you're doing first. So, I'm going to send people to carecredit.com/. Fair Financing Principles, FFP, to get more information about how deferred interest works. You can get zero interest for a defined period of time. Again, buying yourself time to spread those payments out without paying interest. You can also get on plans that have lower interest rates. Again, easing the pain. But the reality is, Allison, someone has to pay for our healthcare in this country. It's really expensive. This is a problem that's not going to be solved overnight.
Bobby, those are such great tips, things that people surely I hadn't thought of. Where can people find you if they want to follow you?
Thank you so much. Well, first of all, you can subscribe to my Substack newsletter. That's bobbirebell.substack.com. And again, you can find out more information about Care Credit at carecredit.com/FFP.
Bobby, thank you. I really appreciate you sharing all of that with everybody because millions of people are worried and thinking about it today. So thanks so much.